So hello friends, now in this particular video we are going to start with coccidiodomycosis, okay, and we also discuss para formats also, okay. So let's start with coccidiodomycosis. Very tough to pronounce it, okay. Coccidiodomycosis. So now let's start. So this is also called as your desert rheumatism, okay, or it is also known as valley fever or California fever, okay. Now it is also a systemic fungal disease which is caused by a dimorphic soil dwelling fungus that is known as coccidioides, okay, which has two species, okay. I will write the name coccidioides, okay, and it has two species, Coccidioides imitis and another one is your Sodaci, okay. So these are the two species. Now it is also dimorphic, remember this. Coming to the pathogenesis of this, okay, this is pathogenesis. So this is also transmitted by same, that is inhalation of arthroconidia, okay. It is spread by inhalation of arthroconidia in lungs. They become enlarged, rounded and develop internal septation to form large sac-like structure of size up to 200 micrometer, which is known as spherules, okay, which is known as spherules, clear, that encompasses numerous endospores like this. This is your spherules, okay, double-layered structure, and here your numerous this structure, okay. So once again repeating, in lungs they go arthroconidia, become enlarged, become your rounded shape, okay, and form internal septation to form large sac-like structure that is known as spherules, and that encompasses your numerous endospore, this endospore, okay. Then this spherule rupture and release endospore, okay, that will disseminate and develop into new spherules, okay. And if returned to artificial media or the soil, spherules get revert back to your mycelial state. So this is the pathogenesis, okay. It will revert back to its mycelial state if these spherules are returned to artificial media or the soil. So this is the clinical pathogenesis. Now coming to the clinical features. So most of the patients are asymptomatic, and in remainder your pulmonary effects is the most common form, pulmonary, okay. It affects pulmonary system. Now presents as pneumonia, so it can cause pneumonia, then cavitary formation, then pleural effusion or nodule formation, clear. Skin lesions such as rashes or erythema nodosum can also be seen. Your arthritis will be seen, clear, especially in women. Then it has also disseminated form, so males and person with low CMI, okay, are at higher risk, such as your HIV infected person, okay. So and common site for dissemination include your skin, your bones, your joints, okay. So these are the clinical features which are associated with this, clear. So rashes, erythema nodules, pneumonia, cavitary or pleural effusion, it can also cause arthritis. Now coming to the most important part, that is your lab diagnosis. So histopathological staining, in which you can do HNE staining, okay, or GMS staining or PAS staining, okay, of sputum, or you can do tissue biopsy specimen, okay, and this all will demonstrate your spherules, okay, which are large sac-like structure, have thick double refractive wall and are filled with endospores. Second, you can do culture on STA, it will produce mycelial growth, okay, and that will be like your barrel, that have barrel shaped arthrospore, okay. The shape of the arthrospores are barrel shaped with alternate cell distorted, okay. So barrel shaped arthrospore will be there, clear. Now one most important point which generally asked, that is your this coccidioids differs from other dimorphic fungi as it grows as mold at both 25 degrees centigrade and 37 degrees centigrade in usual culture media, okay. At both the temperature it grows as mold, but other dimorphic fungi differs from it, clear, and it forms spherules at 37 degrees centigrade in some special media only, clear. So this is a unique feature of this dimorphic fungi. Now cultures are highly infectious, okay. The cultures are highly infectious, so they may lead to accidental inhalation of spores in laboratory, so it requires your BSL, 3 precautions. Clear? Now we can do serology, in which CFT can be done. Okay, and the last is your skin test. Clear? So if it produces at least 5 millimeter in duration within 48 hour after injection, then it indicates your past infection. So this is about your coccidioidomycosis. Now coming to the paraform. Okay, so this paraform is basically also known as South American blastomycosis. Okay, remember blastomycosis, North American blastomycosis was there. Okay, and this paracoccidiodomycosis is also known as South American blastomycosis, or it is also known as Lutz Splendor D Almeida disease. Okay, Lutz Splendor D Almeida disease, and it is a systemic disease which is caused by dimorphic fungi known as Paracoccidioidomycosis brasiliensis. Okay, so this is the causative agent of this. Okay, coming to the pathogenesis. So transmission is same by your inhalation of spores, okay, which then transform into yeast phase in lungs, and it occur as two major form. Okay, two major form. The first one is acute form, or it is also known as juvenile form. Okay, and the second one is your chronic form, or it is also known as adult form. So either chronic form or adult form. So it affects young adults under 30 years of age. Okay, when 30 years of age, it is less common variety but a more severe form, and it is manifested as disseminated infection. Okay, it is manifested as disseminated infection involving multiviscera. Now in chronic form, so it accounts for 90% of the cases. Okay, and it predominantly infects your older men, and it results from basically reactivation of lung lesions. Okay, it is less severe. Okay, so these are the clinical features. Now coming to the lab diagnosis. So in histopathological staining, you will get Mickey Mouse or pilot wheel like appearance. Okay, so histopathological staining of pus, tissue biopsy or sputum reveals round thick wall yeast with multiple narrow necked bud attached circumferentially, giving rise to Mickey Mouse or pilot wheel shape. Second, you can do culture STA on STA, then same 25 degrees centigrade mycelial form and 27 degrees centigrade your yeast form. Okay, then you can also do serology. Okay, it can be done by immunodiffusion. Okay, and also ELISA using your glycoprotein 43 antigen. Yeah, glycoprotein 43 antigen. This is an important MC question. And the last is your skin test, in which you do delayed hypersensitivity testing. Clear? And the treatment is your itraconazole. Remember this, itraconazole is the treatment of choice for this. Clear? So thank you for watching. Best of luck.